The number one question I get across my social media is, how can I become bigger? How can I increase length? Or how can I gain more girth? Today, I'm going to talk about those questions and share the scientific evidence behind treatments meant to increase penile size. I'm Dr. Rena, a urologist and pelvic surgeon. A urologist is a physician who treats the urinary and reproductive system for men and women, using both medical and surgical care. If you find this helpful, make sure you subscribe so you don't miss upcoming videos. Did you know researchers once surveyed about 50,000 heterosexual men? They discovered that around 55% felt unhappy with how their penis looked. However, when they asked those men's partners, about 85% of women said they were satisfied with their partner's genitals. In the end, what really matters is how you personally feel about your body. Still, this topic can be confusing because pornography has strongly distorted what is considered normal. Looking at all available research, the average penile length is about 5.2 inches, or roughly 13.2 centimeters. It is considered normal for length to vary within about 2.5 standard deviations of that average, so length can fall either above or below that range. What's considered medically abnormal, meaning too short, would generally be anything under about 2.9 inches, or around 7.5 centimeters. This condition is known as a micropenis. A micropenis is seen in less than 1% of people, closer to about 0.14% of the population, so it is extremely uncommon. It can happen for several reasons, including birth-related conditions, hormone imbalances, past surgeries, or certain cancers. But today, we're focusing on people who fall within the normal penile length range. While it's true that most people who worry about their penis size actually fall into the normal range based on these measurements, the real concern is often emotional. A meaningful number of men experience distress because they believe their penis is shorter than they want it to be. This can be part of a condition related to body image. There's even a specific term for it called small penis anxiety. It doesn't mean they actually have a small penis. Instead, they experience anxiety because they believe their penis isn't long enough. This is typically defined as a constant preoccupation or obsessive focus on penis size, where someone spends more than an hour each day thinking about it. In some cases, this distress can become so intense that it interferes with normal daily activities. Some men may even require hospital care because of the severity of their obsession, and in extreme situations, some may develop suicidal thoughts. This is not something to take lightly. It is a serious issue that can lead to real and harmful consequences, which is why it's important to discuss it openly as part of overall men's health. Another major concern with this issue is that if you search on Google for ways to increase penis length, you'll be flooded with countless websites and pieces of information that may or may not be trustworthy. Many people end up traveling to other countries or seeking help from unlicensed providers to undergo procedures that can lead to serious and permanent damage. So please avoid doing that. Instead, seek guidance from a qualified urologist or a licensed mental health professional who can properly support you through these concerns. Before I continue with the rest of the information in this video, I want to clearly state that the Sexual Medicine Society of North America says procedures meant for penile lengthening or girth enhancement are generally not recommended and are considered experimental, except in cases involving someone diagnosed with a micropenis. The information I'm about to share does exist in urology research and does have some scientific data behind it. However, before trying any of these approaches, you should first build a relationship with a urologist who has experience in this area. As a side note, I personally do not provide or discuss penile lengthening treatments in my own practice. But because this is such an important subject, I took the time to review the research for you. There are two main categories of treatment options available for people who experience small penis anxiety or emotional distress because they believe their penis is smaller than normal. These include non-surgical treatments and surgical procedures that are mentioned in medical research. Starting with the non-surgical options, the first one is psychological counseling. There are established measurement tools, questionnaires, and evaluation methods that can help you understand what is considered a normal penile size, and also help you work through feelings of anxiety related to this. Interestingly, studies show that people who go through psychological counseling alone, without any additional treatment, often lose interest in pursuing other options, whether non-surgical or surgical, to increase penile length. This is very significant. I strongly encourage anyone dealing with anxiety around this topic to seek psychological support to help manage these feelings. There are 3 additional non-surgical options. The first is penile extenders. The second is vacuum erection devices. And the third is injectable penile treatments. Among these 3, only one has meaningful research suggesting it may help increase penile length, and that is penile extenders. Penile extenders are devices that typically include an opening where the penis is placed, 2 metal rods positioned along the sides, and a silicone ring at the end that holds the head of the penis in place. The device then gradually applies steady traction to the penis to help promote lengthening. This process usually happens over several months and requires consistent daily use for extended periods of time. Research shows that people who use these traction devices very consistently did see some increase in length. In medical studies, penile length was measured using flaccid length and stretched flaccid length measurements in urology. In urology, stretched flaccid length is often used to estimate the size of an erect penis. Studies comparing stretched flaccid measurements with actual erect length have shown they are very close, making this a reliable way to measure size. So what kind of results were seen after months of daily use? On average, the increase was about 2 centimeters. So while there was some improvement, it was generally quite small. To reach this effect, you have to be extremely consistent, using the device every single day for several hours. There are also potential side effects, including numbness, bruising, or simply not seeing any results at all. Some people may invest a lot of time into this process and experience no measurable benefit. At this time, traction devices are the only non-surgical option in research that has shown somewhat consistent results with relatively low risk of side effects. The other options have not shown the same benefit. Vacuum erection devices, for example, have not been shown to increase penile length. Lastly, penile injections have also been tested in different forms, but many have led to severe and harmful complications. Because of these risks, I do not recommend penile injection treatments. At this time, the research is not strong enough to support recommending any type of penile injection. As I mentioned earlier, these injections can lead to severe complications, even decades later, sometimes up to 40 years after the injection was done. Because of these long-term risks, you should never inject anything into your penis. When it comes to surgical treatments, many different procedures have been described and discussed in medical research. One of the most commonly mentioned is a suspensory ligament release. In simple terms, the penis is attached to the pubic bone, the bone located directly in front of the penis, by a ligament. By cutting or releasing this ligament, it can create the appearance of slightly increased penile length. However, this procedure also carries risks and possible complications. There are also other surgical techniques that have been explored, including procedures using tissue flaps, grafts, and even rib cartilage to try to increase penile length. Overall, these approaches have shown poor results and low patient satisfaction. The studies that report outcomes from these surgeries have often not been conducted with strong scientific methods. Because of this, at this time, surgery to increase penile length cannot be recommended, especially given the high number of potential complications. The only situation where surgery for penile lengthening should even be considered is within a clinical trial. So, what exactly is a clinical trial? A clinical trial is a research study performed at a medical institution where there is an institutional review board, often called an IRB. The role of the IRB is to make sure that any research performed at that institution is safe and ethically appropriate for human patients. They also ensure that there is proper data monitoring and a structured system for reporting any side effects or complications that occur during the study on a regular basis. This process helps make sure that any outcomes related to the surgery are carefully recorded and later published in medical research. This allows doctors and researchers to gather accurate, clear, and complete data about a specific surgical procedure. It also helps specialists review results and say, for example, this procedure was performed on 100 patients, only 10 experienced minor complications. Or maybe 20 had severe complications, meaning the procedure is not safe to continue. This is how medical professionals evaluate treatments scientifically, making sure procedures are effective and safe before recommending them to patients. The bottom line: there is very little you can do to significantly change the natural length you were born with. You may be able to gain a small amount of length using penile traction therapy, and this has been supported in medical research. However, many other methods are still being studied and are not recommended for routine medical care at this time. I believe the most important first step is seeking support from a psychologist to help manage this anxiety before trying anything that could be permanent. Some treatments can lead to results that are disfiguring, not functional, and potentially worse than where you started. Thank you so much for watching, and always remember to take care of yourself, because you truly matter.